I'm Dr. Gulam Fatma and today we will discuss respiratory system. First of all, we will discuss the anatomy of respiratory system in this video. Respiratory system consists of two parts. First of all, conducting and second one is respiratory part. Conducting part conduct the air and respiratory part of bronchial tree is the site where gaseous exchange occurs. Conducting part consists of nose, pharynx, larynx, trachea, bronchi and bronchioles till terminal bronchioles. While respiratory zone, it consists of respiratory bronchioles, alveolar duct and alveoli. All these are part of the bronchial tree, which is further subdivided into conducting and respiratory zone. This is the diagram. This one is the trachea, which is divided into two bronchi, and these bronchi further subdivide to form secondary, tertiary bronchioles, and then ultimately terminal bronchioles, respiratory bronchioles, and it ends at the level of alveoli. These all level of bronchial tree are lined by specific epitheliums, which we will discuss later in this video. First of all, bronchi. Bronchi are these trachea divide at the level of carina into two bronchi. Bronchi basically divides at the level of third or fourth thoracic vertebra, where trachea bifurcates into two bronchus, left main bronchus and right main bronchus. Main important thing is this, that right bronchus is wider, shorter and it is more vertical than left one. That is why most of the foreign bodies they enter the lung, specifically in the right lung, through the right main bronchus. Why? Because it is wider, shorter and it is more vertical, so foreign bodies enter more easily in the right main bronchus as compared to left main bronchus. Then this primary bronchus is further subdivided into secondary bronchi, which are also called lobar bronchi. Their number in two lungs are different. There are two left lobar bronchi and there are three right lobar bronchi in the right lung. Then it is further subdivided into tertiary bronchus. Tertiary bronchus, also called segmental bronchus, which supplies the bronchopulmonary segment. This segment is basically the functional unit of the lungs, which is the largest subdivision of a lobe. There are 10 bronchopulmonary segments in the right lung and 8 to 10 segments in the left lung. And then ultimately there is a conducting bronchioles, which ends as terminal bronchioles. Means first of all trachea will divide into bronchi, then bronchi will form the bronchioles specifically terminal bronchiole. These bronchioles, they are smaller subunits of the bronchi which lack cartilage glands and alveoli. It means there is no cartilage present in the conducting bronchioles. Then respiratory bronchioles. Respiratory bronchioles, as we have already discussed, is a part of respiratory zone where gaseous exchange occur. Respiratory bronchioles ultimately forms the alveolar duct and it ends at the level of alveoli. Alveoli is the site of gaseous exchange where carbon dioxide moved out of the body and oxygen is moved in the body. This basically gaseous exchange happen at the level of alveoli, respiratory bronchi and alveolar duct. All these levels are lined by different epitheliums. Like this is the conducting zone, in which bronchi, they are lined by the pseudostratified ciliated columnar epithelium. Then bronchioles, they are lined by the simple ciliated columnar epithelium as shown here, and then terminal bronchioles, they are lined by the simple ciliated cuboidal cells. All these epitheliums are ciliated. First of all pseudostratified columnar, then simple columnar and then simple cuboidal epithelium. and then we will discuss about the epithelium of respiratory zone, where respiratory bronchioles, they are lined by the simple cuboidal epithelium. But remember one thing, these epithelial cells are not ciliated. It means respiratory zone is not ciliated, only conducting zone epithelium is ciliated. And alveolar sac, it is lined by simple squamous epithelium. Alveoli, they are lined by the simple squamous epithelium, as we have already discussed. And alveolar lining, which is simple squamous, basically consists of two types of cells called type 1 and type 2 pneumocytes. Type 1 pneumocytes, they form the blood-air barrier, while type 2, which are 5%, these type 2 pneumocytes, they secrete surfactant. Thank you.